patiently with us. Uh, so, good evening to everybody present here and on YouTube Live. I am Abantika Prasad and I'll be your host for today. I am the General Secretary of South Asian Medical Students Association and a final year student at IPGMER Medical College. And the motive of the Meet the Residents series by SAMHSA has been to inform the people undergoing counseling for NEET PG about life in different specialties and basically to understand what they are fit for and what they should not take up, because that forms a major part of who we become as clinicians and doctors in the future. So I believe this session will be on obstetrics and gynecology with Dr. Abantika Ghosh and Dr. Suparna Biswas. So thank you to both of you for taking out time on such short notice. And so basically, to start off with a quick introduction for both of you to introduce you to the people present here. Dr. Suparna Biswas has completed her MS in Obstetrics and Gynaecology from IPGMER and SSKM Hospital, and Dr. Abantika Ghosh has done the same from IPGMER Medical College, and they both also completed their MBBS with an honors, respectively. So, thank you so much for being with us today. And I think we can join in and start with the first question of the day. That is, exactly how is obstetrics and gynecology as a subject? I mean, we do read about it in final year, but we do not know what comes in with the specialization. So, how different is it from any other branch, or maybe let's say, how would you compare gynae to surgery?
Abantika, I'll let you answer this one first.
Differentiating it from another surgical subject is what we should not actually do, because general surgery people have a lot to do than obstetrics and gynecologists, because we are only concerned with maternal health and childbirth related to cesarean section or non delivery and other OTs which are related to gynae only. But general surgery people have to deal with a lot of organs. So differentiating it from any other surgical branch is, I think, something which you should not attempt to do. If you are interested in gynecology, you should be interested in the subject itself rather than being in the comparison kind of thing.
Yeah.
If we gynecology subject is something which you can be satisfied with your specialty only, because very few of the obstetrics and gynecologists are now opting for super specialty, whereas general surgery, other subjects, maybe you have to do the super specialty in order to excel in life. Gynae, which you can consider as an end branch. Sorry, I don't know what Dr. Suparna has to say, but gynae as is in it an end branch. So
No,
something like
definitely. Yeah. I do agree with you, Abantika, on this one that gynae itself is an end branch. If you want it to be an end branch, you will be very satisfied with it at the end of the day. And another thing is definitely you should not compare it with general surgery, because I personally never liked general surgery. I wanted obs gynae and I only wanted obs gynae. I've never liked general surgery as a subject because it's too vast. You need to know anatomy of a lot of organs in the whole body in general. It's vast, and it doesn't even come close to being compared with obs gynae, because obs gynae in general is a very sensitive subject. It's you're dealing with a woman, you're dealing with women and child, and definitely it's a lot different from any other branch. So if you like the subject, you have to like it for the subject itself. It cannot compare it with any other branch in that way. It's definitely
yes,
different.
and better, it's my advice, you better should not take it as a compulsion. Please opt for the subject only if you like it. Because otherwise, at the end of the day, you may be having some frustration or representation.
Yeah, Akshita? Yeah. Well, I would say because see that is a big issue which people face initially when they're opting for this, this subject, but especially from the bachelor's in surgery. But I think with time, by the time you get to second year and third year, you're exposed to a lot more gynecology and core gynecology, I would say, which you're not exposed to in UG. Because there's stuff beyond hysterectomy and cystectomy and stuff like that. There's urogynecology. There's vaginal operations which surgeons don't do, like general surgeons don't do. So there are operations which are specific to gynecologists itself, right? So I think once you get into residency, you understand there's a lot more to obs and gynae than what we actually know as an UG. So yeah.
Okay, so that makes a lot of sense. Uh, to Dr. Shashank, I believe this meeting is open to all people and it is not restricted to
Yeah,
just
the
Sansa
medical
members.
understanding.
So, if in case any of your friends do want to join in, you can share the link with them and ask them to join in. Okay, so moving on to the next question. Since this is an end surgical branch, and like you highlighted that it is very different from general surgery, so there are a lot of people who have this doubt before taking up gynae, and they think that if they're not getting a surgical branch, let's say if they're not getting general surgery, they should maybe opt for obs gynae, or maybe they can take up some other subjects like ENT or ophthalmology. So we had sessions on Optha and ENT, and we were getting similar response from the senior residents here. So what would you like to say about that?
Um, so I would say that, well, again, surgery, ENT, ophtha, gynae are four completely different subjects, but the lifestyle is what makes the difference amongst these four, I think. Because in ophtha and ENT, you do get a decent amount of life balance as a resident. I feel maybe, I'm not sure, but I think what I've heard from my counterparts, ENT and ophtha are core surgical fields, definitely, but also you get that work-life balance in your professional life later on. And for surgery, also, I think it's a long learning curve. So you, like Abantika said, you have to go for MCH nowadays because our generation, everybody wants to go to super specialists, nobody wants to go to just specialists anymore. And gynae, it doesn't, again, I'm stressing on this, you do not compare obs gynae with these three subjects because obs gynae requires a lot of physical and mental stamina. Uh, it's a completely different branch. So only if you're absolutely interested in obs gynae as a subject should you go for it. Don't go for obs gynae because just because you like surgery, because it also deals with the obstetrics part. It deals with core gynae part. It deals with the women population in general. So a lot of factors come into the subject when you select obs gynae. It's very, very specific. Because it's an end branch, it's very specific. Same goes for pediatrics. Only if you like working with kids will you go for pediatrics, right? So again, with obs gynae, it's your love for the subject and your love for working with that patient population. That's what should factor into your choosing the subject, not just surgery. Definitely, surgery is a big part of it, but not just surgery, right? So, Abantika, you want to add something to this?
Yes. Yeah, something what they are saying is that you're again going into the communism part, which you should not be going that way. Uh, and as Suparna said, that there is a better work-life balance in the other surgical subjects, including general surgery, which is not possible for us gynecologists and obstetricians because we are dealing with very sensitive issues, which is matter as well as liver health. So, the people who have already decided to take a gynae, my advice to them would be that you be ready for a really very hectic schedule, and there is for PGPs, all the rounds are hectic immediately, especially in the first year. But you get into the subject you choose for some time, you will definitely begin to like the subject, whichever branch you are taking. Just do not go for any comparison. You have had your internships, you have had talk with your seniors. Based on that, you decide which subject you will take, not because of I want a surgical branch, I did not get general surgery, or I did not get obstetrics gynecology. For that I'm ending up taking ophthalmology, and then I find that ophthalmologists are only concerned about eyes. This should not be the case. Okay, once you take up the subject, before the subject, you need to take decisions in a full mind, and after that, you should choose your own. And better you should not go for comparison, because life is different in every branch, and which is not comparable to any other branch. When I say maybe ophthalmologists or ENT specialists have a much better work-life balance, they might because after illness, what you choose differs from subject to subject. So it should not be any hard and fast tool, but obstetrics and gynecology is hectic. It was hectic in the I have had my house internship also in obstetrics and gynecology, so I was quite well acquainted with how it is going to be, and so I have taken it up in it, and I am of course quite happy with it.
Okay,
Yeah.
okay. So that makes a lot of sense, and thank you so much for answering this question. Uh, Talking about taking it up and I mean getting into the field, and since you've already highlighted on the work-life balance, so would you say that there isn't much balance during the residency itself?
Well, yeah, but because I think there's some connection problem. So should I go ahead?
Hello, am I audible? Oh, actually, I'm having some technical issue on my end. Okay, Dr. Suparna, please proceed. I will be joining.
Okay, fine. So it's not about see, once you enter residency, no matter which branch first year resident you talk to, everybody will say it's hectic. Okay, whether it's I mean across all branches, because residency itself is hectic. It's supposed to be hectic. Depending on the patient load at your hospital, it is going to be very difficult for you to have a social life beyond residency. But that is mostly restricted to first year, maybe half of second year, I feel, because once your first year is coming and once you're well trained, you can get some, time for yourself and for your family and friends, and that does happen in residency. But again, Obstan is a very demanding branch, and residency, you have to understand that you have to give it your all, because that is the core training period, right? So your bosses will expect a lot of you, your visiting students, everybody, unit head, everybody will be expecting you to work responsibly, be disciplined, and learn as much as possible and extract as much as possible from residency. So they do have a lot of expectations. So sometimes that leads to a lot of frustration. And with the patient load that's increasing every day, I don't think residency is going to get any easier. But work-life balance, I think, depends on you. If you can stay organized, if you can manage your time well, I think work-life balance, it's up to you how you want to, plan out your week or plan out your day in general. So it's entirely dependent on you. And after you pass out, again, it's up to you what you want to specialize in or what you want to do scholarships in. And depending on that, you can choose your work-life balance. Because obs and gynae is a mix of both medicine and surgical parts, right? So you can go into core medicine part of obs gynae, or you can go to core surgical part of obs gynae. So you have that option. You can always choose a life for yourself, which strikes a good work-life balance. But during residency, I would say definitely it's hectic. It is hectic, but that doesn't mean it's going to last forever. Second year and third year onwards, I think if you really know how to manage your time well, you can have a decent amount of balance in your life. So it's nothing like that. Yeah, Deepika?
Actually, exactly, I agree with you. If you want to decide your work, how you will set up your work-life balance, that is actually in your hands only after you pass it. During the resident year, as Dr. Suparna said, it's really very hectic. But if you are organized, you will be able to make up some kinds of itself, although I know it's very difficult and it varies according to the patient load of the respective hospital, which is always high in hospital. Every hospital, especially in West Bengal, all the OPD departments are always overburdened with patients. And moreover, since mental death is a very sensitive issue, so each one of us has to be very much vigilant and very much dedicated. It's not that only that because the seniors in school or the seniors are expecting. It's only also up to you because dealing with a sensitive issue and you are in future going to deal with this sensitive issue. So it's better to be dedicated from leadership itself. It is hectic, of course, it is hectic, and there's very little time for yourself. But that is only during the initial part. After that, gradually, when you will be doing the cases, means when you will go to the operative field, you will feel satisfied in the entire thing. So, but from all these hectic things, when you find that you are doing an OP successfully, that's really a very contented surgeon itself as well.
True, true. It's like it's. I think both of us can honestly say that both of us are really passionate about the subject. So once you're really
Yes, of
passionate
course.
about the work, I don't think it really feels like work. Yeah, definitely there are good days, there are bad days, mostly bad days sometimes during residency. But if you're really passionate about the subject, I don't think it always seems like work. You feel a sense of, a sense of
Yeah,
satisfaction.
satisfaction at the end. Yes, exactly.
Exactly. Yeah, it is a very rewarding branch. It's an extremely, extremely rewarding branch. So I think that really keeps you motivated. So
Okay. So again, moving on, how should somebody choose their college? And again, putting in the perspective of MS versus DNB here, do you think somebody should go in for a government college with a very huge uh, workload or a very huge patient load, or should somebody decide to take up DNB in a private college? Do you think maybe DNB has a lesser value or puts you at a lesser position in any way?
This is not actually this is not true. Okay, whereas you have a decent rank to take up MS, obviously you will take MS in a government college. There is no option about it. But if your rank permits you to take DNB, nobody is DNB is inferior to MS. It is not so at all. Nobody will discourage you to take DNB if your rank permits. But if your rank is MS, obviously I would ask you to go for MS because it is recognized degree, right? And DNB is recognized mostly in the private sector, means the corporate sector. If you in future, if you are planning for joining in medical education service, I think then MS is a better option. But no degree is in any.
yeah, definitely. I think, Dr. Abantika has touched on a lot of important points because it's no longer in one, being inferior to the other. It's nothing like that. Obviously, if you're getting DNB at a government hospital versus DNB at a private hospital, you should definitely go for DNB at a government hospital because, again, patient load is what matters to you because you need enough exposure. And there is no, and when you're going about choosing a college, to answer your first question, you should not only think about the patient load in that sense, but also look at the variety of cases if your rank permits you. Obviously, you should go for a government hospital because obs-gynae, it all depends on how much patient load you have seen. But also consider factors like, how many gynae cases are
Future
you.
of this is depending on patient load.
Yeah, yeah,
Exactly.
yeah, patient load and also the exposure to gynae because it's not just always, about the number of cases you've done. It's not just about the number of vaginal deliveries and number of cesarean sections. It's
Types
also
of cases.
the types of cases, exactly. Like
Number of cases that matters. Yes,
yeah,
exactly.
because a lot of peripheral government colleges don't have that exposure to gynae as such. And as a postgraduate resident, I think exposure to gynae is equally important because you're not just going to be a practicing obstetrician. So if your
Yes,
rank permits
exactly.
you, you should also explore the gynae part of it, when you're speaking to residents in that hospital. So that also should be a matter of consideration. Okay.
What would you say about the infrastructure of a particular hospital and how should a person consider that when going ahead for a college, what would you think about, say, a government college, which is maybe in the periphery and not as well established? And would you recommend somebody to take a private college over that kind of a government college?
Infrastructure is infrastructure on the basis of what? Means, if you consider infrastructure on the basis of laparoscopy, then obviously I would say that you would opt for a college where there is enough laparoscopy cases available, so the PGTs are also being exposed to it. Because in the outside world, when you will be paying for cases, then nowadays even the patients from rural areas, they were aware that not I don't want to cut my abdomen. I just want to make a hole and just this to the camera. Even they are aware of laparoscopy today. So infrastructure on the basis of laparoscopy and infrastructure, I don't know what the infrastructure on the basis of other things means. What infrastructure are you talking about?
Yeah, so I think in terms of infrastructure, see, every government hospital or every hospital has a labor room and has an OT. Okay, those are the two basics that you need to practice as an obs and gynae. So labor room and OT, if a hospital has, then the person will obviously, that's why they've been sanctioned to get an MD or the MDC. But if you're talking about laparoscopy, like Dr. Abantika said, yes, nowadays laparoscopy is something that you should be exposed to. So you should see that if you're, when you're listing choices, if there is laparoscopy, but don't think that you will get a chance to perform laparoscopy or actually, get exposed to it that way. You can maybe see cases, but don't talk to residents. Don't get influenced by residents saying, "हाँ यहाँ पे तो कोई laparoscopy होता ही नहीं है, हम लोग को कुछ दिया नहीं जाता है," because you won't be given laparoscopy. Okay? You'll just be exposed to those cases. You'll be observing those cases, and please don't base your choices on the fact that don't reject good, well-established government hospitals on the basis of just laparoscopy. Okay, because you also need exposure to patient load and all that. That is equally important because you might be strong with obstetrics, maybe your laparoscopy exposure will come later. That is also something that should factor. Okay, so don't reject a good hospital just because वहाँ पे laparoscopy नहीं होता, something like that. Okay, so that is
Right,
something that you should also consider. Yeah.
right. That makes a lot of sense now. Uh, so I got this question from someone recently, and they asked whether a person aiming to become a gynecologist or an obstetrician should they have any particular personality type.
Whatever personality type you have in university residentship, you will get into type A personality.
Yeah, but I think I can honestly say that my co-PGPs, we were three completely different people. I was in the middle. There was one who was type A, and there was one like who was type B, and she stayed type B, and now she's passing out and going off, and she's still, very calm and extremely soft-spoken. So it's nothing like that. I have seen. I never thought it was possible, but I have actually seen a real life example of it. That if you're soft spoken, you can still be a very good, obstetrician gynecologist. There's no such.
Actually, it's not depend on your personality at all.
Yeah, exactly. I think it all depends on you as an individual. I don't think the environment will make you, rowdy or anything like that. It's nothing like that. It's all on your, like on your own self. Yeah.
Okay, so thank you for clearing that out for us. I think Dr. Suparna just got disconnected. So, Dr. Shagun Dubey, I can see that you've raised your
Hello,
hand. Yeah.
hello. Yeah, hello. Good evening,
Hello.
everyone. It's an honor talking to all of you. My query is, like, if I'm interested in obs and gynae, but what if I don't get MD or MS or DNB at my rank, and I'm getting all other branches? Should I opt for, diploma obs gynae, or should I go for the branch that I'm not interested in, like MD, MS, and other branches like surgery or opthal or the other branches? Because maybe I'm not sure,
Okay.
maybe I will not get MD or DNB in obs and gynae. So can I opt for a diploma? Like, will it be a good
See,
option?
see, actually the diploma seats in all colleges are gradually being replaced. There are only a very few colleges which still allow the students to study in view. Okay. So I think in near future, diploma is not a degree which is going to be recognized soon, which is just going to be obsolete soon. So I personally do not support you taking diploma. And for considering other side, if you are solely passionate about obstetrics and gynecology and do not want anything else, then there is an option for giving it a chance, taking a chance next year. Otherwise, if you feel that you have already given a lot of attempts in NEET PG entrance, then you can opt for any other branch and you have to be content with it at LPG. But taking diploma is not something which you should be doing, not at present. It's only going to obsolete. Most of the colleges, all the diploma seats being replaced by MNC. Professor Suparna actually and she is asking that what if at my rank I do not get MS in obstetrics and gynecology, I get diploma in obstetrics and gynecology. From that I get MS in other surgical fields. So I got them that should I take another subject or should I continue doing diploma in obstetrics?
Yeah, I think I have heard your answer a little bit of Abantika. Yeah, you're definitely right because diploma is a very dicey subject right now. I mean, dicey degree right now. So you have to go for only if you're absolutely hell bent on practicing as an obstetrician gynecologist, then only you should maybe consider diploma. But just for the subject itself, but you have to go for DNB or you have to go for MS after that again. And if you're considering surgical branch in general, then you can obviously explore MS and other subjects. I think that's a better option because MS is actually more preferred MS or DNB over diploma any day. So yeah.
Okay, so what if we convert diploma into DNB by giving PD set exam? Is it does it hold the same value as MDMS?
Maybe because see, I obviously wouldn't be the best person to answer about that because it's better you talk to a resident who has actually done, a post DGO, PDC, PDCB, DNB, because that person will be giving you a better idea, a person who's out there practicing. Because honestly, I haven't really explored that option, so it wouldn't be fair for me to answer.
Yes,
Okay.
and I hope it matters. It matters if you want to join NEET later.
Hmm.
In
Okay.
practicing field, I'm not actually quite well versed with it. It's better to ask some seniors who have already done it. But in NEET, it does matter. Joining NEET does matter.
MS is always favored more. So, yeah, that is definitely true. If you want to join the teaching profession, join as a medical faculty in any government college, then definitely you should go for only MS because even DNB is not preferred that way, I think. Yeah,
Okay. Thank you. Thank you so much. Thank you for clearing my doubts. Thank you.
yeah, sure.
So, how would you
If
explain,
someone else and
Dr. Afifa? Do you have a question?
no, if someone else raised a hand,
Yeah, I do have a question. Can I ask it now or should I wait for the end of the session?
Uh, Completely your own choice because I have a ton of questions after this. So,
Okay, all right. So I'll go ahead with it. Actually, the thing is that like all over India, people consider West Bengal Obs Gynae to be the best. But I have reservations regarding the 3-year bond period. That's the only thing that I have. So I'm thinking if I get a seat elsewhere, maybe in Bombay or Delhi, I'll take it up. So I just my question like, will it be worth giving my West Bengal seat up for another seat just because of a 3-year bond period? And another question, I'll club it together. Since both of you are from like from RGKR and SSKM, like in West Bengal who will be taking up Obstetrics Gynae, most of us are confused
actually your
regarding the
voice is
order.
cracking.
Yeah, your voice is cracking. Could you please repeat the
Your
question?
voice is cracking.
Hello,
Yeah,
Yeah.
what will
Your
get
voice is
open?
cracking in the middle.
Yeah, and then after that, it phased out.
is it better now?
Yeah.
Yeah, yeah.
Okay. Was my first question audible?
Yes, we heard your first
Yeah,
question.
first question was
Okay.
what's the next
Second
part?
one, what should be the order that we put in our counseling form? Like normally people prefer RGCAR first and then like I don't know that it's maybe it's over the years that's the trend that people have followed. I really don't know. So since you all have done it from two different colleges, I think it'll be best if you people guide us regarding that. Thank you
This
so
is
much.
not this is not something which should be discussed publicly in a group meeting like since it has been since the years last past years people have been following the trend of putting archer first and then medical college and then after that the remaining colleges. But I don't think as 2023 is covered it matters because in all the colleges where the individual colleges was, all the residents are getting more or less the same type of exposure everywhere. So in today's world, this question is
Yeah, so I
you can
think
offer any college. You can offer any college you choose because initially it used to matter because there were a lot of referrals and all, and RG was considered to be the highest referral center. But with time, restrictions have been made and the referrals have been restricted. So that does not make any special to others compared to others. So I think in today's world, my patient was 2020 to 2020. In these 3 years, as I have inquired from my residents of other colleges, it does not matter whether in which college you are doing it from. More or less, all the residents are getting the same type of exposures everywhere.
yeah, I think yeah. So I agree with Dr. Abantika. The thing is, when it comes to the Kolkata colleges, that is MCK, IGCAR, NIS, CNMC, and SSKM. Sorry.
SSK.
So basically, if you're confused about these five colleges, I would say really get a detailed account from all the senior residents in that hospital. No first year, second year, and third year will be able to tell you properly or give you an honest account because third years are always under exam pressure, and first years will anyway hate their hospital. Okay, so I would say that. So basically, because it's difficult, it's a lot of exhaustion. So I to talk to the senior residents in that hospital who have just passed out, find out the faculty, find out the variety of cases, find out because faculty keeps changing and people get transferred from here and there, so it keeps fluctuating. So I think then you have to consider when you're considering maybe the West Bengal top five colleges, then you have to consider the faculty, you have to consider the variety of cases. And about surgeries, everybody
Even
agrees
if
it's surgery.
as far as the faculties are concerned, they are keep on getting transferred. So
Yeah,
the
exactly.
faculties
So
which we are getting now, it's not that we will be getting the same set of faculties the next year when
yeah,
we actually start studying. So
yeah.
actually, in this point of view, I think according to in my 3 years, I had
Yeah.
exposure with a lot of faculties
Okay.
because
So it's very
MCM and others
unpredictable,
were
I would
transferred.
say. So I
So
think
no
you
one
should
sees.
definitely talk to the
Even my
senior
guides
residents who
got
have just
changed.
passed out in that hospital. So in terms of, the exposure to cases or the variety of cases that comes there and also it's not just about the hospital, it's about the unit that you are in. I think that also, again, it depends on your, yeah. So
Yeah, that is, of course. In
that
any hospital, the unit that
exactly.
you
So
are in
really
is the
talk to
most
the
important
residents and
factor.
find out. And in terms of giving up your West Bengal seat for Delhi or Mumbai, I think if you're getting a seat with no bond, you should go for it. Because nobody wants a bond at the end of the day. So definitely go for a seat with no bond. You can always come back and do your senior residency in any hospital and stay non-bonded and get as much exposure as you want. So bond is a headache. So yeah, definitely go for it. I hope that answers your question, Dr. Afifa.
Oh, thank you so much. That solves a lot of doubts. Thank you.
All right. So, proceeding to next question. about some of the recent things that are coming up in the field of obsgyne, and maybe maybe other than laparoscopy, maybe what are the other recent advances that are coming up, and maybe 10 years down the line or 15 years down the line, what would be something that would be very common to see in this branch?
Recent advances, what you were trying to say, those are actually beyond reach of the residents. Okay, that the recent advances like robotics or fertility preservation, these things are beyond the scope of residents. So I don't think this session demands any discussion on these.
Yeah, the thing is, recent advances, if you're talking about the scope in obs and gynae, you'll always be a good practitioner. Like, there's never going to be any, decreasing demand for obstetricians and gynecologists. There's always going to be a demand. So, yeah, this subject will always stay in fashion. Whether you like it or not, it's going to be there. It's always going to be in demand. And in terms of recent advances, in terms of scope, initially, I think there was no subjects like, for DM or MCH, but now you have fellowships, now you have DM, now you have MCH. You can go for DM in reproductive medicine or fetal medicine. You can go for the core surgical part, which is gynae oncology. I think some institutes even have MCH, or maybe one institute has an MCH in urogynecology. Then you can go for, DM in genetics if you want to go into core research. So there's a lot of options. If you want to super specialize, you can super specialize. If you don't want to super specialize and just stay as an obstetrician gynecology, you can still be, doing wonders in it. So you don't have to restrict yourself. If it's entirely up to you how you want to expand in this branch, how you want to move forward with it. There's endless opportunity. It's never going to be restricted. So I hope that solves your query.
Your answers are not about the scope of the subject, because the scope of the subject is the next question, and the question after that was supposed to be what are the subspecialties and opportunities for postdoctorate or fellowships that are coming up. And I actually also had another question, which was that how would you compare these post doctorate postings and fellowships in India versus other countries?
Okay.
That is something which is beyond our reach actually, because these things you can get clarity only from those who have pursued these courses. We have just actually, as for me, I have just passed my MS in obstetrics and gynecology this year, and I have my seniors who have been doing fellowships and who are doing super specialties, both in India as well as abroad. It's actually it's up to whether you want to settle here or you want to settle abroad. So based on that, I think you should your degree, proceed for the MRCOG exam if you wish to, so that you can practice abroad. But when it comes to comparison, that comparison between super specialties and fellowships in our country versus super specialties in abroad, I think actually it is something which I am able to discuss at this.
Yeah, I think again, it's see, I do have friends who are pursuing fellowships abroad, and the thing is, it all depends on you as an individual, because for fellowships abroad, it's all about your financial condition, or whether you can, if you can invest in a fellowship abroad and go and get that degree or get that fellowship from outside. It's all on you as a person, because it's not like the fellowship that you're doing in India is any different from the fellowship that you're doing out of country. Okay, so it's all the same. Ultimately, it's just having that exposure outside. That's it. And if you're, again, she mentioned MRCOG and stuff. MRCOG again is a completely different topic. But if you want to go for fellowships abroad, you can. It's entirely on you. If you want to go for DM or MCH here, again, it's a super specialty. So it's again 3 years. You're looking at 3 years of postdoctoral fellowship again. So postdoctoral trainee, right? So that is again, it's very exhausting. But if you are up for it, you can definitely go for it. And if it's not like, if you don't have the DM or if you don't have the MCH and you just did a fellowship in that subject, whether it's from South India or any other institute in the country or abroad, it makes you any inferior to the people who have BM or MCH. It's nothing like that. There's no hard and fast rule right now. We don't know what the situation will be like 10 or 20 years down the line. But right now, there's not much of a difference, honestly speaking.
The friendship changing subject is actually obviously up to you. If
Yeah,
you want to
exactly.
pursue it, then that depends on you as an individual. There is no compulsion that you have to opt for it.
Yeah, exactly.
All right. Thank you. So there was a question that is, since this is such a hectic field, how much do you think is the risk of burnout in this field?
Risk of?
Burnout.
Can you please
Burnout,
repeat your
burnout,
question, Ishita?
burnout, tiring, exhausting.
Burnout.
Yeah, burnout.
Burnout. Yeah, but that also depends on the individual, how much you can tolerate, how much how much work you can give, how much hectic schedule you can tolerate. That is depending
Yeah.
up to you as an individual. Your basic health status is not good, means you get tired easily or you have some very other comorbidities. I think it's not to opt.
I think no matter how passionate I have always been about the subject, it's
Your
you
health should be first priority.
Yeah. The thing is, no matter how mentally prepared you think yourself to be when you're entering this residency, there will be days when you really doubt yourself. Okay. There will be days when you actually doubt your choice, where you feel like, I should not even be here. But honestly, there will be bad days in any subject you choose, okay? Because it's residency. It is supposed to be very exhausting. It will be very daunting at the end of the day. So, there will be times when you'll actually feel like giving up on yourself, when you'll feel like, this is not the subject for me. Look at my friends, they're all out there having fun. But, you know, uh, again, the love for the subject really keeps you going, and it's a very, very rewarding branch, extremely rewarding. So once you pass that first year phase, once you really start, looking at the bright side of things, which is I'm pretty sure you will develop a great bond with your co-PGTs, with your SRs or whoever, like your unit. Your unit becomes your family. So once you develop that healthy environment, once you become a second year, just promise yourself that you won't become toxic. As long as you promise yourself that, I think that gets passed down over generations, and your unit itself becomes, breaks that barrier of toxicity. So yeah, so it's all on you to change your work environment, and it's all on you to, just prevent any kind of burnout. But definitely there will be bad days, and I'm not going to sugarcoat it and say that, there will be days when you won't feel good enough. But it's all about, once you're done with this, you look back at those days and you look back and you say that, okay, I've come out as a much stronger person. And that only increases your love for your subject more, because it is quite a hectic subject, and it demands a lot from you, but that does not mean that it comes at the cost of your mental or physical health. Please don't think that. I don't want to, discourage anybody.
Yes, yes,
Yeah.
and I have nothing more to add. Talking about toxicity, as most of you have a notion that gynae is a toxic drug and all these females are toxic. It's actually not, because the essence of the subject it requires it's related to such a subject is maternal health and neonatal health. So the responsibilities that everyone taking, even your senior is taking, that is really very helpful for himself, for him or her as well. So do not consider it to be toxic. Okay, initially you will find it very tiring because there is a lot of work to do, much more than what you think of. It's not something which can come to an end soon. Okay, it will remain, and work list goes on increasing. But initially, if my advice for all of you will be those who are already planning to take up that journey, if you do your work well, complete your work in time, do not consider it to be overburdened. Okay, consider it that it is my job, I have to complete it. If you do it well without any going into any arguments with the seniors, in due course of time, you will develop a good bond even with the most toxic person of the department. Okay. In the
Okay.
end, means at the end of 3 years, you will be coming up with some relationships which are really very, very valuable. That is also another contending factor for you, apart from, as Suparna said, that it is a very rewarding branch. It is rewarding branch in itself, as well as rewarding them in terms of certain bonds that you will be seeing during your training. That is not only true for Gynae, I hope for every department. Do
Yeah,
not consider any subject to be toxic. Just do your work. Just try to complete your work on time. Take care of your health as well. In that, at the end of the day, you that you have actually grown up into a more mature human being than you were previously in your pre days.
exactly. It's very essential for you to take care of your physical and mental health, that I must say. So don't ignore your food and your sleep just because, there's so much work to do. Because nobody's going to scold you for prioritizing your own health, honestly. And I
Exactly.
think everybody is really aware of this now. So don't worry about, it being, very daunting for you. It's nothing like that.
All right. So,
Yes,
thank you
Ikshita,
so
are you
much for
there?
that. Yes, yes, most definitely, I'm here. So there was one more question that I had, and that will bring me to the end of my list. And that question is, can you tell us about the week of a resident? 1 week of a
Different.
resident.
Wait. Actually, yeah, I can, but I think that will be discouraging for the ones who have already planned to take up.
Yes,
Actually, the week of resident it varies from college to college, right? So I don't think this should be discussed. I can of
I think
course tell you what.
it's a very controversial question
And
to ask. Because I think it's not just like what Dr. Abantika said, not just varies from college to college, but also within colleges, it varies from unit to unit. So,
yes, exactly.
yeah, so so maybe a person who is a resident in Monday unit will have a very different opinion of that person's week compared to a person who's working in Wednesday or Thursday or middle of the week. So it's
People of Monday unit and Saturday unit are very unlucky because they have 48 hours of existence.
so yeah, exactly. Saturday, and for people who are working on Saturday, their Sundays are also gone. So I think that's a very dicey question to ask. So also it varies from college to college because I'm sure Dr. Abantika's weeks were much different from what my weeks were as a resident. So it also depends on your location of the college and
Yes, it
your
should
work in general. Yeah.
exactly.
So I think it's. I think
You
that will
should be talking about the week of resident of the college which you are asking for.
Yeah, exactly, exactly. So to understand the week of your resident in that particular college, I think it's better you individually call up those residents and find out, from
Exactly.
different college. That would
And I
answer
am
your
from
question.
the batch. I am from the batch who remained for 2 years because of COVID. One NEET exam did not take place. So I was first year for 2 years, and I had the week of residence for the 2 consecutive years. So I have
Exactly.
survived it. That means it's not that hectic. I have survived it and very successfully survived it. It's not that difficult as you think.
Yeah, exactly. We even had a period where we had no interns. So
Yes,
because there was
2 months,
yeah,
2 months
it,
period without intern. So
so yeah,
I
it's
think
also
when you are in something, you will always definitely come up with a solution to every problem of your life.
exactly, yeah. It's all individualized. So I think it would be better if you talk to the residents and call them up individually. So I hope that answers your question, Akshita.
Okay, Dee, thank you so much. So, if anybody else has any other questions, something maybe that I missed out, please do feel free to tell us about it. And if anybody else has any other questions, you can put them in the chat box or you can unmute yourself and ask.
I think Shashank has a question.
Yes.
Good evening, ma'am. My name is Shashank. I've done my MBBS in Chennai. So my question is, I just wanna I was always passionate about Obs Gynec. So I just wanna know how it can differ being a male gynecologist in the future. Oh my God. Okay.
No,
Like,
nothing.
Oh, it doesn't matter. It doesn't matter at all. We have so many male residents in SSKM. I don't know about Archikar, but there's so many male
Yes,
residents.
there are many men residents in Agriculture as well. It doesn't matter at all.
It doesn't
And
matter.
not something you should be influenced by after seeing Dr. G. It's not like that.
Yeah, so you should not worry about that at all, in fact, because
so like
And
actually when I
there
was
is
in
no Yes,
Yeah, ma'am. Yeah, please proceed, ma'am. Abantika, ma'am.
no, you continue.
The thing is, like when I was in internship, I don't know if it was the stigma in South India or the taboo for the females in South India. They actually had like there were days where I used to be just sitting in the OP room, and then they never used to get like they never used to, even if I was there in the examination room, they never used to even step inside the room. I'm not kidding. Like there were days where I had to face that. So like me being all the time passionate with the subject, so this thing has always been there. But to what I heard in North India, I heard that people there, it doesn't matter much. It does all that matters is a doctor.
Exactly.
First.
Like,
Yeah, and that is, see, I think it always depends on where you want to practice. Where are you from in Tamil Nadu? You're from Chennai?
yes, ma'am. Like I'm from Andhra, but I did my MBBS in Chennai.
I think times are changing. People, it all depends on where you want to practice, and you can always take that step. I think it depends on your caliber as a surgeon, as a practitioner in general. If you are going to be a good practitioner, people are bound to come to you. So, with our generation becoming more and more aware, I don't think that's a stigma that's going to take very long for you to break once you go back and
Yes,
practice in. Yeah.
exactly.
So you
Local
had
local
colleagues who
taboos
were males,
remain.
ma'am?
Yes, yes. Yeah, I have colleagues who are male and who are doing very well. I have my teachers who are male, who are very respectable and very renowned in their field. So I don't think it should be something which should defer you from taking up this aspect.
Yes, exactly. And there's so many famous male gynecologists in South India as well.
Yeah, yeah,
So,
they are, ma'am. I know they're there, but this part has been triggering a lot of
it should
dilemma.
shouldn't. If you're really passionate about the subject, that's gonna show in your practice and in your academics. So don't worry about it at all. If you prove yourself to be a good doctor at the end of the day, people will come to you, irrespective of whether you're a female or male. So don't worry about it. If you really love the subject, you should definitely go for it. You know,
Yes,
and
but and one more thing is that local taboos keep on persisting in areas, specific areas. Even in North India, as you said, in North India, people are not that much concerned. But even in North India and even in West Bengal, there are areas where
male
belonging to certain particular communities or certain particular areas, they have that notion that I will not do my checkups from male teachers, male doctors. But it is not so everywhere.
thing is, don't see, we have this idea already that gynae in itself is toxic. So once you enter the branch and you enter residency, you will always think, okay, if somebody talks to you in a little higher tone or in a little negative tone, you are influenced into thinking that that person is being toxic to you. But honestly, we have to learn to take responsibility for our actions. And I would say that, look, first year is not in your control. Okay, I can say that maybe my department was not toxic, and I've been lucky that way, but not everybody is fortunate. So as a first year resident, it's not going to be in your control what unit you are getting or what kind of department you are in. That is not going to be in your control. But once you become a second year, you can make it a safe space for your juniors and develop good relations with your seniors, because I think it's all on you as an individual, because once you become a second year, you can promise yourself that whatever negativity and toxicity or whatever I have faced, I will not pass it on to my juniors, and the juniors will learn the same and pass it on to their juniors, and that way that cycle is broken. And I think that is something that is dependent on you as an individual. So first year is not going to be in your control. I will not give you false hope, because different colleges all over India are different. But don't go with that negativity. Go there and try to focus on yourself as an individual and try to think, how can I be more responsible and how can I avoid getting shouted at or whatever, because that is what is most important. Just be disciplined and turn up and be responsible. Nobody will say anything to you. That's it. Nobody expects you to know a lot. Everybody just expects you to work. That's it. So yeah, so I think it's all on you to break that cycle. So just promise yourself that, and I think that's going to make a difference. Is that okay for you, Shubham?
Thank you, ma'am. Thank you so much.
Okay, you're welcome. Does anybody else have a question? Ipshita. It's okay. labor room is a very different environment than the gynae OT. So if you're considering general surgery OT and gynae OT, maybe you are, you're talking about the scalpel, right? But gynae also involves, I mean, OBGYN also involves the labor room environment. And at times, maybe the night that you spend in the labor room, maybe that was very calm, but it can also happen that the night that you spend in the labor room can be really charged, and people are shouting at each other, and then everybody is, if there's an ectopic coming in, or everybody is like pouring over one patient, and it's extremely charged and everybody is running around, so that will give you a very different picture. So yeah, it's not just one night in labor room and OT. I would say that do your internship really well in your hospital. uh, that would give you a decent idea of what you would want to work in. I think Dr. Abantika.
Yes, and yes, one night is not enough for taking the decision for the entire life. Of course, I hope you have completed your internship or you are doing internship, whatever. Experiences in internship, of course, will help you guide your future subject. But as you said, but if you are equally loving both the subjects, then you should take the subject which actually is an end branch at present. If you are interested in doing specializations and super specializations and are okay with it, then you can take a general surgery. Because only being a general surgeon in today's world, I think, won't make it that much. But as Dr. Suparna already said, that obstetrics and gynecology will always be having your patients, and your demand will remain high even if you do not do these super specialty degrees.
Yeah.
You consider this factor while taking this test if you are loving both subjects equally.
And since you're a final year, I think, Ipshita, final year student, I think also factor in how much you love studying the subject, because you have to remain with the subject for the rest of your life. So these are two very different subjects. So yeah, so I think really study these subjects well while you're studying in final year, and find out what really appeals to you more. And then to corroborate likes and dislikes, you can go into internship, do that well, and see what really appeals to you. And then you can take your decision, right? And depending on what Dr. Abantika said, depending on whether it's an ed branch or what you want to do in life later on. So that comes much later, but see the subjects first. Okay.
If you're, yeah, exactly. If you're a final year student now, then you should wait for internship. Yes.
Okay, I think I don't think anybody else has any questions, right?
Yeah, and people are leaving as well.
Yeah, I think.
Okay, then. It was nice interacting with all of you.
Okay, so thank you so much. Thank you so much for coming and telling us all about this field. And I mean, it's really glad to see that uh, gynecologists are usually nice to talk to because I have seen this a lot in our hospital as well, that there's always some chaos going around, and everybody's always busy, and then you ask somebody something, they'll be like, "हाँ ठीक है, answer बता देंगे," but then they'll be like, "Why don't you study? Why don't you do this? Why don't you do that?" And it was very nice to talk to both of you, uh, and not see a gynecologist sitting.
Gynecologists in the living room and dishes from gynecologists outside the living room. This you should over your head.
Okay. So, thank
Yeah.
you so much for coming in, and
And
thank you to everybody who joined in and got their doubts cleared. So, with this, I would like to conclude